Alrighty, here we are. How long's it been since I did a video? Months? I know I haven't done too many since the initial injury that gave me this little gem. Here, let me fan back here for you. You may be familiar with this contraption. This is what they have you wear for 6 to 8 weeks after a rotator cuff repair. This is not new to me. This is my third repair. 2008, 2015, now here we are, say 2025. That's when the injury and then the repair happened. Background on that. So September 12th was a Friday afternoon. I was doing something here around the house, moved a little wrong, and as soon as I did it, I knew what happened. It was just one of those things. The pain was pretty sharp right off the bat, so I was pretty confident that I knew what had happened. And because it was a Friday afternoon, I don't believe, if I recall, I don't believe I called the orthopedic surgeon that day. I think it was probably Monday before I called. They got me in pretty quick because I am a return patient, especially to the orthopedic surgeon that does the shoulders. And got me in, looked at it, pretty sure of the diagnosis. And of course, with shoulders, the complexity of the joint, it's impossible to diagnose without imaging. So scheduled me for an MRI. Apparently in Greenville, it's backed up for MRIs as much as it's backed up for every other kind of medical attention you may need. So it was a few weeks before I got the MRI. And so yeah, let's see, the injury was the 12th, got me in pretty quick. The MRI wasn't until October. May have been October 1st, if I remember correctly, which was a Wednesday. Does that sound right? And then Friday was the follow-up. Yeah. So yes, Friday, then October 3rd was the follow-up with the surgeon, and it was confirmation that indeed I had torn my rotator. Now, if you're not aware, the rotator cuff is essentially, I'm being a little loose with it here. Essentially, the rotator cuff is the tendons of the muscles around which your arm rotates. Supraspinatus, infraspinatus, all those terms you don't really care or need to know. I tore 3 out of the 4, and the MRI showed some damage to the labrum, but on the upside, there was no damage to the bicep tendon, which is part of the complicating factor from the surgery in 2008 was the bicep tendon was torn. And there were no, obvious other complications like bone spurs and things like that. I had bone spurs on the clavicle and the scapula in my first surgery. And so there was that. Now, if you recall, in April of last year, I had open heart surgery. And in that, I'm the weeks following the open heart surgery, I said to anybody who would listen that it wasn't that bad. Yes, open heart is scary and it's life-threatening and all those kinds of things, but as far as recovery went, it wasn't all that bad. I mean, I was lifting weights less than 6 weeks after. I was cleared at 6 weeks, but I had already been doing it. There were things I waited to do, kettlebell swings and things like that I did not do right away. But recovery was pretty good, pretty easy. And I told people, this is way easier than a lot of the other surgeries I've had. At that point, I had had 7 orthopedic surgeries. I would have said at least 5 of them. At least 4, maybe 5 or 6 of them were worse than the open heart. But far and away, the worst surgery I ever had, as far as pain and subsequent recovery, was this first shoulder surgery. I cried every day for a month. Physical therapy was brutal. I had 8 to 12 hours every day of the week of therapy. They sent a machine to the house to use for therapy. I went to the physical therapist 3 times a week for therapy. It was pretty rough. I mean, I had a real mess in there, but it was a rough surgery. So subsequent shoulder surgeries, and then all 5 of my foot surgeries, not great, especially compared to the open heart. So having said all that, let me reiterate, shoulder surgeries suck. I'm just a day or 2 out from being tethered to an ice machine. Because it's been 4 weeks and 2 days since surgery. Surgery was December 16th. And that's 24/7 on the ice machine. Sarah and I have purchased more bags of ice. Yeah. So anyway, my first actual physical therapy where they moved my arm was this past Tuesday. And excuse me. So that's where I'm at. I'm not able to drive. Apparently, in South Carolina, it is advised. It's not illegal explicitly or implicitly. It's not illegal to drive with a sling on. It's just if you do anything, they have any reason to pull you over, and you're wearing a sling, they can ding you for. I don't forget now if it's unsafe for conditions or impaired, physically impaired. I don't know what. I don't remember the what they would end up falling back on. But I just thought, you know what, I have other things going on here. I don't need to throw that in the mix. I don't need that kind of harassment. So, not driving. My mess of hair, that's kind of just pulled back here now, is impossible to do one-handed. I'm just grateful that Sarah will help me get the knots out and just pull it up and get it out of the way. She wouldn't let me cut it. She knew I didn't want to cut it, so she didn't let me cut it, even though I would have cut it just to not have to deal with. The last time I cut off that big old 17, 18-inch ponytail was for a shoulder surgery. So a shaved head, when you can just go like that with some dial soap and be done, is a lot easier than all of this mess. It's just that I'm losing so much of it anyway. As it thins out, I didn't want to lose it all at one time if I didn't have to. Anyway, that said, within days of the surgery, I was out here exercising. Not so much on the cardio, because really the only thing I'm advised to do right now is walk. So when it's nice and warm out, I walk outside in the driveway or up and down my street a little bit, or on my treadmill like I'm doing today. However, I have also been lifting weights. How in the world do you do that? You do it one-handed. Like you're doing damn near everything else right now. You're doing it one-handed. You can do overhead presses and I'm using a band for rows and pull downs. I'm doing back here one-handed. Curls, whatever I can do one-handed with a dumbbell or bands or cable or whatever. So I am exercising. I'm trying to keep my upper body as strong as I can, at least on this side. Studies have shown that exercising the good side does present benefit to the bad side, or the injured side. So that's part of my thinking too, is I got to keep pushing as much as I can on this side to help benefit this side in repair and recovery. So that's what I'm doing. Yeah, that's it. I've had other complications, post-op complications that were no fun, that I think have gotten past for the most part right now. Some reason my body decided to throw a cellulitis infection at me and a kidney stone at me in the weeks after the surgery, so that's been fun. Lucky for me, the things that they give you at the hospital for a kidney infection are the things I already had because of the surgery: pain meds and nausea meds. So yeah, my body's response, because I've had kidney stones before, my body's response is usually to throw up. And so once I got past that for a couple days, I think eventually. No proof because I didn't strain my urine to catch the stone because that's not a one-handed type thing to do. So I'm just peeing, but I've been peeing. Pretty sure that stone's gone now. And then the cellulitis, they put me on antibiotics for a week, which the last one I took actually was this morning. So I think we're past that too. When you're used to exercising as much as I have for years, all of a sudden not being as active is a wild ride to see what happens to your body. I want to say overnight, but it was a few days. My legs got more swollen, and of course that was also cellulitis on my leg. But we're past that, and we're on the mend in multiple fronts, and we're gonna just keep plugging along, and I'll be back to work probably in a month or so, and we'll go from there. But yes, in case you've wondered, when you haven't seen my posts of my exercise, it's just because it's been minimal and intermittent and very repetitive. But yes, I am still exercising. That's it. Thanks for watching.